Hello, my name is Dr. Eric Herbranson. I'm the Vice President for Education for eHuman. Today I'd like to show you some of the features of the Tooth Atlas version 6.0 for Hygiene. This product is got new additions. We'll go over those. Right now I'm going to give you an introduction to the features of it, and then we'll go through each feature individually at some depth. And you'll be able to download these small vignettes as you see fit, or you can download the whole movie. So let's go to the first page, our splash page if you will. We'll click on this, and this gives us to our main navigation page. And you can see in the middle we have a picture of a mouth. If we roll over these teeth, you'll see that we go from the different upper molars. The nomenclature changes from the universal to the palmar to the international, and this is how you get into the permanent tooth section. So in this particular case, we'll select an upper premolar, and this gives us the ability to look at this in a number of different ways. We have rotations and slices, which is photography, computer models, and the comparison with x-rays. We have three-dimensional models that allow us to use models that can be downloaded and freely rotated. These are annotated. We'll get into this later. It's a section on morphology, which is drawings of the teeth. There's a section in comparisons, which are also drawings, but it compares the individual teeth to the ones next door. And section on radiographs, how to read a radiograph. Section on x-ray databases, where we go through a whole number of teeth to show the significant variations that you get in anatomy. And then there's a study quiz at the end to test your knowledge and to help guide you into the areas that you should study in. Go back to the main page again. There's a primary tooth section, which mimics the permanent tooth section. Again, you roll over the teeth to select the ones that you go into, and you've got the rotation slices, 3D models, etc. that you have with the permanent teeth. There's an eruption schedule in here that shows the mineralization of the dentition versus age. Starts at 9 months and goes through adulthood, and we will go into that later. There's a interesting section that uses a child mummy CT scan to show how you can apply this knowledge to archaeology. And this allows us to look at the skull inside the cartonnage. We'll go out of this section. There's a section on dental embryology and another section on odontogenesis that we'll look at in the individual sections. Another section on periodontology that displays a very nice model of a whole arch with all the structures laid out that are applicable to a periodontal situation, shows probing and shows periodontal defects, shows us gingiva versus the periodontal defects, bone losses, etc. There's a quiz in here. It's presented in two ways, a simple model and a more complex one. And then there's a very nice periodontal morphology PDF that you can use as a study guide. We'll go back to the index page again. There's a skull osteology section, which has got actually 3 sections. There's a section where we have photographs, serial photographs of skulls, which we'll get into in a few minutes. There's another section where we have 3D models of skulls, which we will look at, and there's individual skulls as well as sections, and there's an annotated maxilla and mandible we'll get into also. This section is dissections, cadaver dissections with the structures laid out. Go back to the main index page. There's an x-ray database. This is a way of looking at the x-rays that are contained inside the Tooth Atlas by being able to search them for different types of attributes. So normally they're presented as being of a specific tooth type, but this way you can look for canals, curves, etc., dens and dentae, things like that. There's an ADA mock board examination, which is a old national board examination, and it gets the student tuned up as far as what the questions are like, as well as what areas that they should be looking at if they're going to take the national board examination. There's another section on occlusion, which shows the arches in occlusion, open, points of contact. We'll get into that as an individual lecture. Small section on extras, which is basically a lecture on caries, aging, and then a small movie gallery, which we'll talk about. Lastly, there's a section on a glossary, which goes in and gives you definitions of all kinds of different dental terms and what they mean. And I'll show you how this ties into the rest of the atlas on the fly as we're doing this. Another advantage of this version, and probably the strongest change that we've made, is we've got a clinical part of this. We found out that clinicians like to use this in discussions with their patients, but because it was so academic that they had to wade through all the academic content to get to the part that they'd like to use to show to their patients. So what we did was create another way of navigating through this that's more applicable to the discussion that the clinician may have with their patients. And that's what this section reflects. We have a primary tooth section, a skull osteology section, and so what you'll do here, for instance, is click on the tooth that you're interested in showing the patients, and you end up going straight to this section with just the tooth involved on a nice blank screen, and you don't have to worry about the academic content that's on the side. So this is a improvement, and it's really a nice addition to this, because it does in fact make the use clinically a lot easier. So those are the features of version 6 of the Tooth Atlas Dental Hygiene. Now what we'll do is go through each feature individually.